Hello and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. We're going to use the next 20 or 25 minutes to explore new additions to hhdw.org, content maps and indicator search tools, which we're also calling indicator indices. The impetus for this edition came from the observation that we have so many indicators in our system that sometimes it's hard to know everything that we have and to find exactly what you're looking for. We figured other data sites might have the same problem, and we did a little investigating. So with some thought and creativity and a lot of help from our GRA, we came up with two solutions for hhdw.org: content maps and indicator indices. Currently on the site, we have content maps and indicator indices for the Behavioral Risk Factor Surveillance System, or BRFSS, and the Pregnancy Risk Assessment Monitoring System, or PRAMS. So these are helpful to navigate the 327 BRFSS indicators and 164 PRAMS indicators we have in HHDW. A content map and indicator index for the Youth Risk Behavior Survey will be coming. On the website, we try to do our best to organize the indicators in a way that's easy to search, such as using categories and subcategories to separate out different groups of indicators. For BRFSS, we have the 8 categories shown here, and each one has its own set of subcategories. So while this simplifies the search process, it can still take some time to find exactly what you're looking for. For PRAMS, we use these 6 categories, and subcategories, again, are located within each category to help narrow down your search. So, for example, in before pregnancy category, you'll find subcategories including alcohol, tobacco, and drug use, mother's health, preconception healthcare, and pregnancy intention and contraception. So let's talk about the content maps first. They feature all the indicators from BRFSS or PRAMS currently in hhdw.org. They are organized in the same categories and subcategories as you see on the indicator selection page on the website. They provide you with the ability to see all the available indicators at once. Here's a peek at what the PRAMS content map looks like. You can see all 164 PRAMS indicators organized into the same categories and subcategories as you find in HHDW. So it maps out the location of each available indicator on the website so you can easily see what we have to offer. Now, it's a lot of information, and you probably will have to do some zooming. Here is what a smaller part of the PRAMS content map looks like. So this shows the demographics and some health insurance coverage and before pregnancy indicators, just to give you an idea. With its 327 indicators, the BRFSS content map requires 2 pages, but you'll still see the same categories and subcategories as in HHDW, making it easy to find your indicator of interest on the website. Before we jump on and take a look at them, let's just talk about the indicator indices. So these also feature all the indicators from BRFSS or PRAMS currently in HHDW. And just like on the content maps, they're organized into the categories and subcategories seen in hhdw.org. However, this document will also provide you with the indicator selection title, the full title, the question wording, the years when data is available, and the variable type. So for example, variables can be yes, no, or categorical. And the indicator index is actually downloaded as an Excel spreadsheet, and as such, it can be filtered, sorted, and searched to help you find exactly what you're looking for. Here's a look at the indicator index for BRFSS. By default, it's sorted alphabetically by the first column, but you can change that sorting. And you can see it lists the categories and subcategories used on the website. And then it gives you the selection title, and this is the text that's used on the indicator selection page. So it's the actual name of the indicator. But it also gives you the full title, which has a little bit more information, and then the question wording, which shows you the question that the indicator is based on. And then when we're looking at the live site, I'll show you the years and the variable type. The PRAMS indicator index is very similar. It operates in the same way as BRFSS, and we'll explore these in a little more detail in just a minute. But first, I want to show you where to find these great resources. There are 2 simple ways to get to the content maps and indicator indices on hhdw.org. Choose either BRFSS or PRAMS from the data source menu on the HHDW homepage. This will take you to the homepage of the selected data source, in this case BRFSS. And then if you click on the button that says Build a Custom PRFSS Report, it will take you to the indicator selection page. And on this page, under the overview section, you'll find links to 4 different resources: our data release notes, the content map, the indicator index, and the most recent coffee break webinar related to the data source. So you can click on the link for the content map to see the PDF, or click on the link for the indicator index to download the spreadsheet. And then just to show you another way, from the home page, you can also click on build your own report right here. And then this will show you a page that has images for each of the data sources. So you can click on BRFSS or PRAMS, and it will take you directly to the indicator selection page. Let's go ahead and take a look at the live site. So we'll check out the BRFSS resources first, and I'm going to go this way. So I'm going to choose data sources and go to BRFSS. And I'm going this way because I do want to show you the home page. For those of you who aren't as familiar with the website, this is a great resource. It has information about the survey itself, and then all of these technical information. It has the actual surveys, our release notes, which is basically anything new or changed with every year of data that we load, and then the CDC documentation, which is very detailed. And then below this is where you can make a record level data request for BRFSS or a report request. And then there's also a couple of data sources at the end for additional information. So that's a very helpful page to know about. But what we're going to do is we're going to go to build a custom BRFSS report. So this opens up the health indicator selection page. This is where all the indicators actually live. If you were interested in any of these particular topics, you can navigate using the arrows to see what exactly is available. But if you just want to see everything and see what's available before playing around and navigating, that's when these content maps and indicator indices are going to come in handy. So let's take a look at the BRFSS content map. I mentioned it's 2 pages long, because we do have a lot of BRFSS indicators, but it contains the same 8 categories and all the same subcategories as you see on the website. So it's just a way to quickly see everything that we have related to a given topic. So for example, if you were interested in high blood pressure and cholesterol, you could zoom in and see that we have these indicators here around high blood pressure and cholesterol. Or the same thing for nutrition or physical activity. So it's a kind of indicator at a glance resource. There's also some links to helpful pages, the BRFSS homepage, that one that has all the surveys and the CDC documentation. You can get there from here. You can get to the indicator selection page from here. This will take you to the indicator index. And then if you have a record level request, this takes you to those instructions. So that's the BRFSS content map that will hopefully make searching for things a little easier. So if you click on the indicator index, it's going to open up a window for you to download the resource.
When you click on the indicator index link, depending on how your system is set up, the upper right corner here, right next to your icon, this is the downloads button. Depending on how your security is set up on your computer, it may indicate that this spreadsheet is an insecure document because they've decided that XLX files are potentially dangerous files. So depending on how your computer is set up, it may open automatically, or it may come back and say, this is an insecure document, and you have to confirm that you want to keep the download.
But once you do have it downloaded, you can see here all the different columns, and we're showing all the different subcategories. So this breaks things down into much smaller topic areas. So if there's a specific area you're interested in, you can just filter to that subcategory. And then we have the selection title, which is the title that's used on the website, the full title, which gives a little bit more information, and the question wording. So that's very helpful to have because it lets you see exactly what the respondent was asked. And then you can see here the years of available data. This is very helpful too if you're looking at specific indicators, and the variable type, whether it's or no or categorical. So I just want to show you a couple ways that you can play with this. As I mentioned before, you can filter by subcategory. So for instance, you are interested in injury indicators, you can just filter to the injury subcategory. And here you can see that we have all of the indicators about falling, spinal cord injury, traumatic brain injury, and seatbelt use. So that's one way you can use it, just by filtering to a specific category or subcategory. But you can also do a text search, and I'm going to use the full title and do a text filter. So say we were interested in kidney disease, and we look into the subcategories, and there's no subcategory called kidney disease, but we figured there's probably indicators in here. So we can search, and sure enough, we find out, okay, there are kidney disease indicators that's in the other chronic conditions subcategory of the chronic diseases and conditions. So here you can see, again, the full title and the question wording and the years and everything. So of course, you can also just do a regular search using the find and select. But the nice thing about using the text filtering is that it only shows you the relevant indicators. All right, let's take a look at the PRAMS resources. So we'll go back to the home page and we'll go this way this time. So to build your own report. And now we can see that we have the option of the 6 different data sources available in HHDW. So we will check the pregnancy risk assessment monitoring system, and it will take us to the indicator selection page. So again, this is where you would access any particular indicator that you're interested in. And it is also where you will access the content map and the indicator index. So again, for the content map, here we can see for PRAMS, it's just one page, which is great, although it's, there's a lot of information on here. There's also these helpful links. And so, for example, just like with the BRFSS, if you were interested in, say, breastfeeding, you could zoom in and see what all do we have about breastfeeding. And you can see that we have quite a few: initiation, duration, liquid supplementation, and then source of breastfeeding information. So it just gives you all of the indicators that we have in one spot, makes it convenient and easy to navigate the system. Let's take a look at the PRAMS indicator index. So here we're seeing, again, all of the categories and subcategories that are available on the website. And there's all of the indicators are available here. So again, you can filter on the category or subcategory. So for example, here, and this is interesting because some of the subcategories will span multiple categories, like mother's health. You'll see that we're getting indicators for after pregnancy, before pregnancy, and during pregnancy. So if you wanted just say during pregnancy, you could easily filter here and get just the indicators of mother's health during pregnancy. Then we can also do the same searching and text filtering that we did with the BRFSS. So for example, if we were interested in, let's say, Medicaid, so let's see what indicators we have about Medicaid in here. And you can see we have 2. So one is about barriers to oral health care and the other is insurance prior to pregnancy. And then of course you can also do a regular search using the search and find. So here is an activity we'd like to work together. So take a few minutes to explore the content maps and indicator indices on hhdw.org and answer these questions. So let's take a look at these activity questions. The first one is going to use the BRFSS map, and we're looking at how many BRFSS indicators are there about secondhand smoke on HHDW. So we'll go to the BRFSS content map and we'll find the category that we're interested in, which is going to be substance use. And then we'll look under the tobacco subcategory, and we might have to zoom in here a little bit, but we'll see that there are 5 indicators present about secondhand smoke, SHS. So the correct answer to that question is 5. The next question involves the PRAMS content map, and it asks, at what points around the pregnancy can you find PRAMS data about maternal depression? So we'll check before the pregnancy and we'll see that yes, there is a question about depression before the pregnancy. During the pregnancy, there's also a question about depression, and after the pregnancy, there's a question about depression. So you can get information about maternal depression before, during, and after the pregnancy. The next question is a true or false. BRFSS contains an indicator about surfing. Well, I would just do a text filter with surfing in it, and we can see that yes, it's true. BRFSS has an indicator for adults who surfed in the ocean in the past 30 days. There's also one for body surfing. And then for the last question, what years are there data for mothers receiving information about breastfeeding from a lactation specialist? So again, here, I would either filter onto breastfeeding and just take a look, or, lactation is kind of a specific word. So I might also try a text filter. Okay, so here we go. This is the indicator that we're interested in, breastfeeding information from a lactation specialist. So we can just scroll over and see that the answer to this question is 2016 and 2019. We look forward to seeing you in September when we will be talking about maps and geographies in hhdw.org.